Hi, I'm Dr. Aimie, and in this video I wanted to share a little more about the effects of trauma on the body. And today we're going to talk about the GI issues. Trauma gets stored in the nervous system, and it's going to affect especially the whole digestive system, because that's where it's all under the control of the various nerves, whether that's the sympathetic, fight or flight. That whole plexus is in the pelvis, or the parasympathetic, which is going to be your rest and digest, which is where you want to be for a healthy, functioning digestive tract. So this can go very wrong if you have any form of trauma or chronic stress where like a freeze response gets wired into your nervous system. So what can happen is a variety of things, but no matter what happens, like it's uncomfortable, it's inconvenient, and it can exhaust you having to deal with whatever GI issues you have, whether that's more IBS type of stuff, irritable bowel syndrome, or more on, well, I guess with IBS it can be constipation dominant or diarrhea predominant. But either way, what happens is a lot of the digestive tract just gets shut down, especially when we have any kind of trigger, re-traumatization, any stress in our life that feels overwhelming, or we get that. See, I just take a deep breath. This is me thinking about, all the overwhelming stuff that's happened recently in my life that's kind of put me in this place where I feel like my digestive tract shuts down. And when my digestive tract shuts down, it not only gets painful, but it feels like there's a lot of inflammation, and even a lot of bloating can happen. So I wanted to share with you something that I've been using now for quite some time to directly kind of counter the long-term effects of trauma on my body while I'm doing the other stuff to not have any more trauma and stress compounded on my system. So I wanted to talk to you about vitamin C today, because that is going to not only help the digestive tract that's recovering from trauma, but also just the body's health in general. We know from the ACEs study, the Adverse Childhood Experiences study, that people who have histories of trauma in their childhood, and this is going to go for attachment trauma as well, that they do have a higher prevalence, incidence of diseases, chronic diseases in adulthood, including autoimmune diseases. So autoimmune diseases are when your immune system gets out of control. It starts attacking things that it should not be attacking, or it is ineffective in clearing infections and kind of signaling when there is a real problem. Vitamin C is going to help with all of that. Vitamin C is going to reduce overall inflammation in your body by stimulating all the reactions that help clear toxins, that help boost the immune system. I mean, vitamin C is obviously known to help you when you get cold or upper respiratory infection. It's always, take vitamin C. But the amount of vitamin C is what may surprise you. So at this point, depending on my day, actually, not only my week, but depending on my day, I can take anywhere usually from 6,000 milligrams to 15,000 milligrams of vitamin C a day. Now that can seem a lot to you if you're not used to hearing these numbers with vitamin C. Usually for common stuff, 500 milligrams, 1,000 milligrams seems like a lot, but you can't overdose on vitamin C. And given the amount of inflammation that can happen in the body, and I have known for a few years that some of my autoimmune markers are off, and so that kind of is extra motivation for me to just be as strongly anti-inflammatory as I can. And so I'm going to take vitamin C because I know that once my body reaches its limit in how much it can take in, it's just going to eliminate the rest. And so you may not have heard this as well, but there is such a thing called the vitamin C flush. And this is for people who tend to maybe be more on the constipated side of things, that if you take a lot of vitamin C, it will kind of be a laxative for you. And so I've seen people who have not been taking large amounts of vitamin C, and I talk to them about vitamin C, and they go out and they take 5,000 milligrams the next day. And then within 30 minutes, they're needing to go use the restroom, which is fine if that's also what you need to use it for. But it may also be one of those things where you have to build a tolerance of it and build up to levels that you can take. And I would recommend you take as much as you possibly can, because you can't go wrong with it. You're going to reduce the inflammation in your gut. You're going to thus help your gut issues recovering from trauma or chronic stress, and you're going to reduce your inflammation levels in your body. So I would probably recommend starting anywhere between 3,000 and 5,000 milligrams every day. You can't go wrong with that, and then just build it up as high as you can. And I tend to not like to take a lot of pills, or I should say, since I take a lot of pills, supplements, whatever I feel that I need. I do get the vitamin C that comes in the 1,000 milligram pills, so that I can just minimize how much I have to take to get the quantity that I want. And then I'm taking the ester C form. I was taking the powder form before, but that was really hard on my stomach, and it felt almost like it was burning a little bit when I would take spoonfuls of the powder form of vitamin C. And so I stopped doing that, and since I've switched to the pills, my stomach tolerates it much better. My gut health is happier, is better, and it also is a little bit of a stimulant. It helps wake me up, gives me a little bit more energy throughout the day. So give vitamin C a try and see what it does for you.